Okay, so hello guys. This is another person of Panda from ESIC Medical College, Joka, Kolkata. So today our topic of discussion will be which is better, diagnosis based treatment or symptomatic treatment. So we will first briefly introduce both of them. What is diagnostic based treatment? Diagnosis is knowing the cause, and after that we are treating the cause. So if we are treating the main cause, so the effects are going to diminish, right? So this is diagnosis based treatment. And then what is symptomatic based treatment? Symptom based treatment, which is what is that? So basically we are treating the symptom without treating the etiology, isn't it? So what in symptomatic treatment, let us briefly discuss what happens. So in case of a symptomatic treatment, we go to each and every symptom and try to treat those symptoms to relieve the patient. Like if someone is having fever, so we are giving him paracetamol. Having inflammation and pain and all, even in that case also we are giving paracetamol, but we are not going to the root cause of the disease. What is the disease? We don't have any idea. So here it have pros and cons. So let us discuss about the pros. Okay, so in Indian setting, what happens? Indian setting, we have less resources. The amount of resources we have in tertiary and secondary care, maybe it is available, but in case of PHC and most of the CHC also, we don't have that much facility to go, and also time. The population is very high in India, so we have time issue. We have also the issue with the resources. So it is like practically impossible to go to each to diagnose each and every disease and then treat that. Okay, so in Indian setting, our primary goal is to relieve the symptoms of the patient, and for that we like not always, but maximum time we have to go to the symptomatic treatment. Symptomatic treatment is also maximum time when it is done, it is associated with clinical diagnosis also. It is not like that you are giving a patient symptomatic treatment and you don't have any diagnosis, or at least a differential diagnosis in your mind. You have to have some differential diagnosis, like this can be the cause of this disease. Without that, you can just randomly write any prescription, because you are already like physician, so you can't do that, isn't it? So that was all about the pros. What are the cons? Okay, fever, I said you are giving paracetamol, but fever can arise due to many other etiologies also. Fever can like even heartburn. When we talk about heartburn, patient is thinking that this heartburn is due to heart disease, but it is not always due to heart disease. Most of the time the heartburn is due to GI causes. Okay, so the overestimation is there, like, and again the underestimation can be also associated in that place also. Like I am giving an example, the patient is coming to the OPD with the complaint of heartburn. You said, okay, this is a case of GERD, or it can also like any reflux kind of thing. So I am giving him PPI inhibitor, like PPI. So you wrote the medicine, but after that it was found he was dead. So after that you find that he was having an acute MI. Yeah, acute MI is also the presentation is also the same. The patient will suffer from heartburn. So it is underdiagnosis of a symptom, or whatever the patient is coming and you are giving symptomatic treatment. These kind of cons the symptomatology has, or the symptomatic treatment have this kind of drawbacks. Now coming to diagnosis based treatment. Okay, in diagnosis based treatment you are diagnosing that this is the disease and you have the particular drug you are giving that, and yeah, you are getting the benefit by eliminating the disease, and that's how you get relief from that symptoms, isn't it? Or pain, fever, whatever you are having done. What are the pros? You are eliminating the cause, so the chances of recurrence or chances that patient will underdiagnosed or overestimation, that part is totally not there, it is absent. Okay, and what are other pros? Like the patient believes in you that yes, I know the disease. Sometimes patient and their relatives also have queries because of the Google syndrome. Everyone is just googling or doing Google search that what are the presentation. Google will show like if you have fever, you have blood cancer. So if you are proper diagnosing the case, so you have the benefit that you are getting an upper hand during the treatment. Even for medical legal, if you are getting involved, that is your proof कि this lab investigation I have done, this parameters, based on these parameters I have diagnosed this disease as for example I have diagnosed this as multiple myeloma. Okay, so you have a upper hand in also in medical legal cases which are increasing in India nowadays. Okay, what are the cons? Okay, lab investigations, X-ray, USG, CT scan, genetic diagnosis, biopsy, these all are the test to evaluate and come to a diagnosis, but these are costly. If you are writing that these many lab investigation you have to go through, so you are adding the cost of treatment, adding to the cost of treatment. So in Indian setting, we are not like crorepati. The patients are not like crorepati, like crores. They are not making in crores. Our economical background is most of the cases the economical background is very low, socioeconomic parameters. So we have to be patient friendly कि उन लोगों को इतना पता नहीं है कि ये टेस्ट में इतना खर्चा हो रहा है, तो वो लोग तो बोलेंगे कि सर ने ऐसे लिख दिया, बहुत सारा खर्चा आएगा. तो वो सब आपको देखना है. तो व्हाट आर द कॉन्स कि पहले तो होगा इट विल रेज द कॉस्ट ऑफ ट्रीटमेंट due to various lab investigation and others test, which is not affordable by the Indian population. Second con is that it takes time. It takes a very very much time, very, what to say, like the duration is very larger as compared to the symptomatology based treatment. Like the duration of diagnosis can vary from 1 second to 1 year or more. Okay, clinical based diagnosis, you will get the diagnosis in like 5 to 10 minutes, or even in 1 second. You, if you are seeing a case, you can say that. Okay, and it can also range to 1 year or more. Like in HIV AIDS, you don't know, not for AIDS, like for other genetic causes or whatever the things are. So you don't know the, like rare diseases, you will get confused. You don't know the diagnosis, and it will take a large amount of time or a long duration of time. Patient may die, patient मर भी सकता है. So these are the cons we are having in diagnosis based treatment. Also, let us compare which is best in Indian setting. I think in Indian setting we have it is visible that in rural setting or PHC CHC we are mostly using the symptomatic symptom based treatments rather than diagnostic criteria and going through the algorithm, diagnostic algorithm, and treating the patient. But in from CHC and district hospital, tertiary, some diseases are treated according to their symptoms, some are with respect to that disease. So in the conclusion, I want to say that there are some diseases which are needed to be treated according to their symptom, and there are some diseases which can be treated according to the disease. You can't practically treat your entire life by symptomatic treatment or by the diagnosis based treatment. So in conclusion, this was it. So it was a really interesting topic which I wanted to make a video. I hope you guys are liking the video series. Yeah, इन नया वीडियो स्टार्ट करें जो कि और भी ज़्यादा इंटरेस्टिंग होने वाला है, तो स्टे ट्यून्ड. थैंक यू.